liver. I know most of us would like to have liver in our fried rice and all. So we've seen the liver of an animal. That of the human is almost just the same. It is about 1,300 grams in a healthy adult, and on the upper parts of the abdomen, the right side. So it's usually under the rib cage, just on the right there. Next slide. And then this is anatomy of the liver. We don't really need this. So this is academic. Liver is divided into two sides. It receives blood both from the hepatic artery and portal vein. This is anatomy, this is academic. Next slide, please. The next slide. So this is just a picture of the human artery. Those are the blood supply. That green thing underneath is the gallbladder. I believe if we have slaughtered chicken before, you see one green thing underneath the liver, which is, you are very careful, you don't want it to burst. That's the gallbladder, which contains bile. And there is what we call the pancreas. It's a very close relative to the liver. Next slide, please. Yes, we have to know the functions of the liver. When we know the function of the liver, then we will know the problems that will occur when the liver has disease. There are very many functions, but we are going to summarize them. Number one important function here is the production of that bile, that greenish substance I mentioned earlier, which is stored in the gallbladder. The importance of it is that it helps to digest fats in the small intestine, and through the bile, there are some important waste products which leave the body. We call it bilirubin, which breaks down from blood that normally breaks down every 120 days. The liver also helps us in storing special vitamins, we call them fat-soluble vitamins, A, D, E, and K. It helps to produce things that help in blood clotting, so that when you have an injury, you don't just, all your blood doesn't flow out or examination. The liver helps in producing blood clotting factors. Next slide, please. Then it produces what we call albumin, called the big grandma. It's a protein that God has put inside our blood vessels, the pipes that carry blood, so that the water component of the blood remains within the vessels, what we call help to maintain oncotic pressure. The liver helps us also to control glucose, help to store the excess glucose we call glycogen within our muscles. So when the liver is not working well, blood sugar is not able to be controlled. You find the person's blood sugar eventually going down. The liver also helps to what we say detoxify, breaks down harmful waste in our body, and then transfers this waste into through the kidneys, and then we pass it out to urine, or goes into the bile and it is passed out through the feces. So, and most times the drugs we take are broken down in the liver to become the non-dangerous forms, non-toxic forms, and is finally removed. So when the liver is not doing its job properly, then you rest assured that you are going to have accumulation of the harmful parts of the drugs within the body. Then the liver breaks down alcohol. It has to produce what we call cholesterol. I know many of us know about it here. I'm seeing a senior population here. Most of us know about cholesterol, the fats within the blood. It has to store what we call iron, which has to produce blood. It also regulates amino acids, which is the breakdown of protein that we take. And it gets bilirubin, as I said before, from the blood. Bilirubin, we get it from breakdown of our blood, which usually has a cycle of 420 days. So if the liver is not able to push out this bilirubin, then the person yellow, what we call jaundice. Eyes become yellow, skin becomes yellow. Next slide, please. This is just a pictorial summary of all what we have been saying. So now, going into the meat of today's matter, diseases of the liver. We'll break them down into this: hepatitis, liver abscess, what we call metabolic dysfunction associated with steatotic liver disease, big grammar for what we call fatty liver before, liver cirrhosis, cysts, tumors of the liver, both benign and malignant or cancerous. Next slide, please. What is hepatitis? Big English. Hepa, we are talking about liver. Titis is inflammation, like an irritation of the liver. So it is the response of the liver to different forms of injury. And this liver injury can either be what we call acute, which is a short-term injury, usually occurring less than 6 months, or chronic, an injury that continues more than 6 months. So most times people can have what we call acute hepatitis, and the person may not really have symptoms, may not exhibit any complaints. Alright? And so some of these, when the hepatitis is small, the person may have other things. Next slide. Like just feeling unusually tired, just feeling unusually weak, and then pain on the right upper part of the belly. We call it right upper quadrant pain because that is where the liver is. And so from stretch, all hepatitis there is pain. The passage of dark colored urine, why is the passage of dark colored urine? Those waste products I said earlier, all those bilirubin and its products may not be properly metabolized, and then it's produced so much in the urine and it looks dark. Sometimes they will have itching of the skin because of accumulation of these waste products within the skin. Sometimes they will have vomiting and diarrhea. Then there's one entity here, we call it fulminant hepatitis, which is a very rapid and severe form of liver injury. So that in a very short time, the person has breakdown of the liver cells, and the person can have change in personality, the person becomes irrational, can even go into coma, and some can bleed. So that is in severe cases. So, depending on the cause of hepatitis, it can lead to death, that is in severe cases, or the acute hepatitis can continue and become what we call chronic hepatitis. Next slide, please. So in some cases, for instance, if this acute hepatitis is caused by hepatitis A, hepatitis B, we will speak about soon, the body can have lifelong protection from it. That's if the body can cure, for instance, hepatitis B. In acute hepatitis, blood tests will show increase in the liver enzyme. So liver tests will be done, and the doctor will tell you this bilirubin is high, as waste product, or the liver test will take things as aspartate transaminase is high. So those are the things that can happen when there's acute hepatitis. So in acute hepatitis, how it is managed, as we said at the beginning, in some cases it may just be mild, and what we usually do in the hospitals is that we adequate bed rest. Next slide, please. We advocate bed rest. The person should take a lot of fluids. Then we encourage people to avoid toxins to the liver. What are those toxins? Maybe taking herbs that you do not know what is made of, or alcohol. So at those times there is such hepatitis, we stay away from that. Then we treat what is causing the hepatitis itself. Chronic hepatitis, as we said earlier, is hepatitis that is injury of the liver which is beyond 6 months the injury inflammation goes beyond 6 months, most times patients may not have any signs. Or say it's asymptomatic, whereas there's continuous progression of disease. Then chronic hepatitis, our problem with it is that it can lead to long-term, what we call sequelae, problems, scarring like liver cirrhosis or liver cancer. That's our problem with chronic hepatitis. So it is important that when there is any cause of chronic hepatitis, it is treated to prevent progression to what we fear, that is liver cirrhosis and liver cancer itself. Another disease here is liver abscess. Next slide, please. Abscess, what does abscess mean? Is pus. Most of us may have had boils or pus on parts of our body. The liver can also have pus within it. So this picture here, that whitish thing we are seeing there is pus on top of the liver. Abscess might be just one in the liver, or we have many. Next slide. And most times, people that have risk to develop this pus, old people that have diabetes because their power to fight disease immunity is reduced, or people that their immunity is reduced, like people with HIV or drugs that press down the immune system, people that are maybe long-term use of what proton pump inhibitors, drugs we use for treating what we call, most times people call ulcer. So it can either be due to bacterial or pathogenic infection or a protozoa called Entamoeba histolytica, which causes diarrhea at first, and then the patient will present with this liver abscess. Next slide. How does the person present? Most times there will also be pain on the right upper side of the belly, fever, the eyes may become yellow. So, as I said before, in the one we call amoebic liver abscess, patient most likely would have had an infection of the large intestine we call amoebic colitis. So there would have been history of person say I was having diarrhea, was purging at the time. Next slide, please. Next slide. All right. Sorry. Excuse me. Press. Right. I'm almost there. Okay. Sorry about that. So how do we liver abscess most times most like patient will present to the doctor and tests will be done. Ultrasound will see that there's a cavity containing pus, and most times it's treated with antibiotics. But when the cavity is too big, it can be drained. Either what we call draining, puts either a needle or what we call catheter to remove the pus, either with ultrasound or if it is so big, surgery could actually be done. So the next is liver cirrhosis. This is a very important part of this discussion. You can see the fresh liver on this one side looking beautiful, and the other one looking like having many seeds. This one on this side is the cirrhotic liver, the one on the left. This has become hardened because of disease. What causes this liver to become cirrhotic like this? When there's continuous injury, as I said earlier, anything that causes the chronic hepatitis. There are many viral hepatitis which we talk about, alcohol in our environment. There's some what called the iron storage diseases that we call the hemochromatosis and all that. I don't want to bore this audience with that. So what happens? The soft liver that we know, that when you put the liver, it's very soft, now becomes replaced by a scar tissue. The liver becomes hard, and then you have formation of nodules, seeds within the liver. And so this liver that becomes hard is not able to carry out in normal liver functions as we discussed earlier. So people that have liver cirrhosis, how are they? Liver cirrhosis, when it has progressed, most times the hair becomes fluffy because there is no proper protein within the body anymore. They can have yellowness of the eyes, which is jaundice hair distribution, see some. And the final one here is hepatocellular carcinoma, cancer developing in the liver because of cirrhosis. So what you have to ask questions, we have to examine, but you have to ask questions, biopsy. Next slide, please. So, this is for us, at least for you people to know, when they don't have liver cirrhosis, we do what upper GI endoscopy, which is a camera to look inside the stomach. Okay, so from where when you pass the food esophagus, so check if there are those big veins there that are swollen because of the liver pressure, so that if it is there, it is treated to prevent complication like patient vomiting blood and dying from that. The other is ascites. Ascites is the big swelling of the stomach due to water accumulating because of the liver not able to do its work. We have different ways it is treated. Sometimes through medications we call diuretics, reducing salt in people's diet, then what we call paracentesis, draining the water off the abdomen. So the truth is that liver transplant is what is the final treatment, the only treatment for liver cirrhosis. And you should know that in Nigeria we do not have such facilities, we don't have such. So it is better we should prevent this liver cirrhosis. We know there was a prominent Nigerian that wanted to get a kidney transplant for his daughter. He ended up in jail. So liver is even worse, not easy to get. So let us all be careful so we do not get to this stage of looking for liver. So liver cancers, we know cancer is an abnormal growth. I know there's no one that doesn't have an idea of what liver cancer is. Liver cancer can either be primary, that is just developing from the liver itself, or spread from another organ, that is what we call secondary liver cancers. So the livers that can easily spread to, cancers that easily spread to the liver include those cancers, next slide please. Those cancers from the stomach, the pancreas, they easily spread to the liver. So primary liver cell carcinoma can arise from the liver cells. I don't want to go into, let me not bore you with all this stuff. And we know that hepatocellular carcinoma is the 5th common cause of death, of cancer death in Nigeria. So that's it. Next slide, please. Next slide. Alright. So that's a liver that has a cancer within it. You can see that round swollen spot. That's a liver cancer. It's no longer smooth like the first one I presented. So, once liver cancer occurs, usually survival after diagnosis is usually short, about 3 to 6 months. Next slide, please. Next slide. Alright. So, and in some cases, the patient will just remain even with the disease without symptoms. So that's why we say screening and surveillance in people at risk for hepatocellular carcinoma can make diagnosis early enough for effective treatment. Who are people at risk? For example, some people that have hepatitis B and hepatitis C or are regularly using alcohol. You should screen them regularly for hepatocellular carcinoma. And what are the symptoms? The person just be losing weight. Okay, eyes will become yellow, yes, pain in the belly. Then the liver that is not supposed to be felt in the abdomen becomes swollen. That's what we call the heart tender hepatomegaly. Next slide, please. Next slide. Okay. So, I'm benign liver tumors now, please. So, there are some tumors in the liver that are not cancerous. So, when someone is told sometimes that you have cysts in the liver, there is a swelling in the liver, but it's not cancerous, the person should not be afraid. There are some growths in the liver that are not cancerous. They will just remain with the person. Some are what like hemangioma, like what is hemangioma? A swelling, a blood vessel is swollen in the liver. They are something called adenomas. They are growths, but they are not cancerous. They don't spread. But the thing about them is that sometimes it's just found by chance. They can cause pain. Most times you don't do anything about them. You don't give treatment, nothing, except they are very big or causing severe pain that you can maybe remove them. Liver cyst, next slide please. Cyst is another condition in the liver where you just have accumulation of water within the liver, small sacks of water. Most times they will just be there without causing any problem. So if someone is told you have cystic liver disease, it's not for the person to fret and start immediately writing his or her will. It is usually a quiet disease. Okay. Then there are some other ones anyway, like the hydatid cysts. Those ones are due to infections from parasites and they can be treated. So cysts, they can cause pain just like because of stretch of the liver, and if they are large, if they are causing problems, they can actually be drained from the individual, or the person can have surgeries. Next slide, please. Next slide. So, we first about the common cause of liver disease, viruses, bacteria, excessive alcohol consumption, drugs, what called hemochromatosis, abnormal accumulation of iron, then metabolic associated fatty liver diseases. The viruses that cause liver disease are what we call hepatitis virus. I believe we have heard of hepatitis A, B, C, D to E. Hepatitis A is usually an infection that it causes only acute. Next slide, please. I'm sorry, I just get carried away. I just feel my touching here. Okay. See, hepatitis A virus usually spreads fecal oral. That is stool to mouth through contamination of your water or food from feces of an infected person. So usually incubation period, that's the time from injection of the virus to disease, about 14 to 28 days. Next slide, please. It just causes what we call acute hepatitis. Maximum if it's too long is 6 months without causing further disease. So 90% of children in endemic areas would have acquired it by the time they are 10 years. Most times when it's in children, it does not have symptoms. So most times treatment is next slide. Treatment is usually supportive because it's usually a mild disease, and we can prevent it by giving safe drinking water and which will improve, next slide, improve sanitation and vaccinate against hepatitis A virus. But these vaccinations are not really routine in our environment here. The next is hepatitis B virus. This is the major culprit here. It causes both acute and chronic infection. In people, if children are exposed to hepatitis B, either from the mother, from mother or through blood contamination, hepatitis B. But in adults, 90 to 95% will have acute hepatitis, 5 to 10% will develop chronic hepatitis. Hepatitis B is the main cause of cirrhosis and hepatocellular cancer in Nigeria, and it causes death of a high number of people in Nigeria. So it is transmitted through exchange of blood or body fluids, and it can be found in semen, vaginal fluids, wounds, and saliva. Most times, the virus can survive about 1 week outside the human body. And we should know that hepatitis B is 100 times more infective than HIV, 50 times more infective than hepatitis C. So even a speck of blood that has been on the ground for about a week can still cause infection. Most times hepatitis B is is gotten through mother to child, children to children, abnormal sharing of sharps, unprotected sexual exposure, the transfusion of blood that is not properly screened. As we said earlier, next slide, acute hepatitis is usually without symptoms, but it can have symptoms in adults. So, what are the symptoms of the chronic hepatitis B? They can have fever, the eyes become yellow, pain in the abdomen, irrational talk from the hepatic encephalopathy I mentioned earlier. Next slide. So what do we do? Someone that has hepatitis B, we do blood tests. All these are for us. Next slide, please. And what do we do if it is the acute hepatitis A? That within the first, it's within 6 months. It's actually bed rest, avoid toxic agents of the liver. And if it is fulminant, the person will need liver transplant. Next slide. So, an important thing here is that not all patients with chronic hepatitis will need treatment. There are some that come to clinic, we tell them you don't require treatment yet, but the person must continue follow up to know when he or she will require treatment. Next slide. So this is for us. Next slide. Next slide. Next slide, please. So it's important here to also know here that there is no cure for hepatitis B. We have treatment, but there is no cure. So if you hear this, it does not mean that your heart should sink. When you say no cure, it means that the virus will remain. But the person can actually be treated so that the virus does not cause further damage to the liver. So this should not be what should make everybody feel sad. Next slide. Next slide. So how do we prevent hepatitis B? All pregnant women should be screened for hepatitis B infection. The mother should ensure their children take all the immunization for their children through the National Program for Immunization. Female children should not be circumcised, and when you want to circumcise male children, let them use sterile equipment. Then tribal marking, tattoo, all these tattoos is very common now. People are putting tattoos everywhere. They must do it, they should avoid use of unsterilized equipment. We even discourage it, because sometimes they may say sterilized, may not be. Injection safety, when you go to the hospital, your needle should be discarded. You should not reuse needles. And then proper screening of blood. Then fidelity should be encouraged in marriage to prevent bringing diseases from outside. So, next slide, please. So it's important that people with hepatitis B infection should stop drinking alcohol. And we should not label people with hepatitis B as promiscuous. Because it's moving up and down. It's not only sexual activity people can get hepatitis B from. Let us encourage people to do premarital screening of hepatitis B before marriage. And the hepatitis B does not prevent people from getting married. Once vaccination is taken, the other spouse is protected from hepatitis B, unlike HIV, which does not have the the vaccine. Next slide, please. So people should encourage their siblings to go for their test if you find out you are hepatitis B. Adults who need to be vaccinated against hepatitis B should not take vaccine meant for children. The dose is different. So the next is hepatitis C. It affects a lot of people, but the prevalence, the number of people affected in Nigeria is actually small, like 1.1%. How do people get to the next slide? Usually from unsafe injections, blood transfusion, sharing needles, using unsterilized medical equipment, people just moving up and down, using needles that you are not sure of. Then mothers can transmit it to their children. So hepatitis B will cause only chronic hepatitis and can lead to, next slide please, can lead to liver cirrhosis and hepatocellular carcinoma. Hepatitis C can present with other things. I've managed a patient whose first presentation was skin changes, but he didn't know. He was going to hospital, they kept rubbing things on his skin. He presented to me last year and I discovered that he had cancer from hepatitis C. So hepatitis C can actually have some changes in the skin and can cause kidney disease. So it is not just something related to the liver alone. Next slide, please. So we diagnose hepatitis C. Next slide, please. We diagnose hepatitis C through blood tests. Okay? And there are medications to treat hepatitis C. Hepatitis C has cure, unlike hepatitis B. But the thing about hepatitis C that there is no vaccine. So even if you are cured, you go back to where you got it from, you can be reinfected. Alright? Next slide. Hepatitis D itself is a virus that does not stay alone. Next slide. Someone with hepatitis B is the one that can be infected with D. So you cannot just have hepatitis D alone. Next slide. Hepatitis D itself can co-infect hepatitis B patients and increase risk of the person developing liver cancer. Next slide. Hepatitis E virus, we spread it from, just like hepatitis A, fecal era. Most times in people that have poor sanitation. It causes only acute hepatitis. Next slide. The next one important